Welcome to ETMC TV and this informative presentation by Vivek Patel, MD, a board-certified general and cardiothoracic surgeon at the ETMC First Physicians Clinic in Tyler. Dr. Patel will discuss surgical options for lung cancer. Thank you for choosing ETMC TV.
Cancer of the lung continues to be the second most common cancer in the United States, and that is true among both men and women in the United States. There's approximately 220,000 new cases of lung cancer diagnosed each year in the United States. And it tends to be a disease of older individuals. Two-thirds of lung cancer cases occur in patients older than 65 years old, and the mean age of diagnosis is 71 years old. It's very important that if you're suspicious of lung cancer to get diagnosed early, because certainly our options are a lot greater in patients who have early stage lung cancer versus those who have a late stage lung cancer. The most common risk factors for lung cancer are smoking. Unfortunately, the damage that remains from smoking cigarettes for a long period of time persists throughout someone's lifetime. So even if they may have quit 20 years before, they still remain at significant risk compared to a non-smoking population for lung cancer. Secondhand smoke has been identified as a major risk factor for lung cancer, and so it's important to remember that if you've been exposed to a significant amount of secondhand smoke, that you may also have a significant risk factor for the development of lung cancer. Fortunately, we still do see lung cancer in non-smoking individuals, and sometimes they can be some real rare subtypes of lung cancer that we can see in those individuals as well. So obviously, if you have any of the risk factors that are concerning for lung cancer or symptoms involved, you should seek the attention of a medical specialist. Things that people should look for, things such as a new cough, shortness of breath, wheezing. Occasionally patients will have fatigue or weight loss. They'll cough up some sputum, which may be bloody or rusty colored in nature. More commonly, however, we're finding patients getting diagnosed with cancer who have radiologic tests done for other reasons. So they may have a chest x-ray or a CAT scan due to chest pain or something else that's going on that's not necessarily related to the workup of lung cancer. At ETMC, we've been fortunate to have a weekly lung cancer conference, and at this conference there are several specialties involved. There's surgeons present, medical oncologists, pulmonologists, radiologists, and pathologists all present during the conference. And we'll typically present the studies that have been done on patients and come together in a multidisciplinary fashion to figure out what we need to do next. This is very advantageous for the patient because frequently they can get a second or even third opinion without even knowing about it or having to visit other doctors. Some of the diagnostic tests that patients may require prior to a decision on what treatment they need is very frequently a chest x-ray or CT scan. And this will allow us to get information on both the size of the lesion, where it may be located, whether or not it's in or outside the lung, and also if we have previous radiologic imaging to see whether or not this has been growing over a period of time. At the end of the day, all this data is collected and it's evaluated by your specialist. And your treatment options are based upon the data that we collect, and an important factor is determine what stage lung cancer and also your overall health status prior to determining these decisions. The most common therapeutic decisions that we make are whether or not a patient is a surgical candidate. And if they are, surgery has remained the best treatment for lung cancer today. For most individuals, because we have been able to do an extensive workup before surgery to ensure that their lung function and their overall health status is good, most patients do not have any long-lasting limitations as far as what they can do following a surgical procedure. Radiation and chemotherapy are always on everyone's mind when they think about lung cancer, and those treatment decisions are primarily based upon whether or not a patient is a surgical candidate. Occasionally, if they're not, then radiation therapy and chemotherapy can be recommended for those individuals. And also, following the surgical treatment, depending on what our final pathology shows, radiation or chemotherapy may be recommended to certain individuals.
Dr. Vivek Patel is a board-certified general and cardiothoracic surgeon at the ETMC First Physicians Clinic in Tyler.
I did my undergraduate education at Boston University. I went to medical school in India, and then I completed a surgical residency at the University of Pennsylvania in Philadelphia, Pennsylvania. I did a cardiothoracic fellowship at the University of Rochester in Rochester, New York, and I did an advanced training in adult cardiac surgery in Pittsburgh, Pennsylvania.